Hello, I'm Dr. Ballina. I am an instructor here at Northwestern Oklahoma State University. And with me today, I have my friend Nate Scottum, who is a certified registered nurse anesthetist. So thank you, Nate, for joining us today.
You bet.
First, I would like for you to tell me what is your full name with your credentials?
Yeah, so my name is Nate Scottum, and I'm a ARNP, Advanced Registered Nurse Practitioner, which is the way they order it out here in Washington. And then I have the National Certified Registered Nurse Anesthetist credential as well.
Okay, great. So you're in Washington. Tell me, where are you working? What are you doing?
Yeah, so right now I am working for a small group of anesthetists, and we cover a variety of different facilities. And I'm currently kind of splitting my time between a couple, one doing GI cases on an outpatient basis, and the other is at a eye surgical center. So everything from cataracts and retinas to cosmetic blepharoplasties, and actually have a facial plastic surgeon that comes in, and we get to do some fun cases with him too.
Oh, wow. Well, so how did your nursing journey start? Where did you start? Where did you go to school? What did you do as an RN before you came into CRNA school? Talk to us about that.
Sure. So I kind of took the scenic route through school, and ended up doing a program that was an LPN and then RN in succession, just one right after the other. It just happened to be how that program worked. I also have an undergraduate in biology, because that was kind of my first interest. So after graduating with my RN, then I worked at mainly at United Hospital in St. Paul, Minnesota, for about 8 years, mostly in the critical care float pool, the emergency department, ICU, recovery room, just kind of a variety of things.
Wow. So 8 years. At what point in time did you
Yeah.
decide it was time to go back to school then, or that you were ready for a change?
Well, it was probably somewhere kind of in the middle of all that. And then, like I said, having kind of done my degrees in piecemeal, I had to go back and finish some stuff up before I applied to the anesthesia program.
Okay. And what was that program?
So that was through the Minneapolis School of Anesthesia. And so kind of a smaller school that had originally started out years and years ago as a diploma program, and then eventually became part of the master's degree that's required. And of course, now most schools are all going to PhD type programs.
Okay. So you have your master's. How long did it take you to go to school?
So the master's program was 27 months long.
Okay.
Yeah.
Was it full time? I mean, were you trying to juggle working and going to school?
No, it was full time. They very strongly discouraged any working during it. A few people worked a couple days here and there, but a lot more successful just to concentrate on school. It was a challenge.
Yeah, I imagine. So tell me now, what is that? How has your role changed? Tell me kind of your day to day and as a CRNA.
Sure. So before, as an RN, my main role was on the nursing units, taking care of multiple patients, that type of thing. Whereas now doing anesthesia, it's essentially 99% in the operating room or procedure rooms. Excuse me, taking care of people while they're asleep for a surgery or a procedure, that type of thing. So it's one-on-one care. Your patients are asleep for most part of it, which makes it kind of unique. But it's also very gratifying because we have a huge effect on how they emerge from anesthesia and the surgery, post-operative pain, and potential complications and that type of thing. So basically all operating room based. So.
Okay, Cool. How about what kind of like team collaboration do you experience in your role? So either be it like a project or something like that, or otherwise with other members of the care team?
Yeah, so I guess the biggest way that we experience that type of thing in the setting I'm in now, since we're kind of a smaller group and independent, so we independently contract with the centers that we work for, and so we have to make or find our own protocols, procedures, that type of thing, to have on file, and to work with each individual center, which really became important. When COVID hit, we had to modify a lot of that and work with all these places individually, in determining how we could continue to serve them and work with them to take care of patients as all this was evolving. So that was kind of a big team collaboration, looking at best practices and trying to get ourselves to align with those as best we could, and doing it in a manner that allowed us to keep working too.
Yeah, for sure. I imagine that was probably challenging. Well, any other last thoughts? Something you want to share to us?
Oh, I have so much wisdom. I wouldn't know where to begin. No, I guess the biggest thing is, if anybody's considering, furthering their education, going for more, continuing down the road, from a, I don't know, I hate to call it basic, but a bachelor's level RN, that type of thing, and getting into more of the specialties, I absolutely go for it. I don't regret it one bit. It's a lot of work, but definitely worth it. There's so many different ways you can take it, and find what speaks to you and go for it, I'd say.
All right. Well, thanks, Nate. We appreciate the interview.
You bet.